In this picmonic, we describe the musculoskeletal disorder Lambert-Eaton myasthenic syndrome, or Lambert-Eaton syndrome, as the lamb eating everything in its presynaptic path. This syndrome occurs due to antibodies to the presynaptic calcium channels on motor neurons, shown as the antibodies with calcium cows on motor neurons. Muscle weakness occurs because these antibodies cause a type 2 hypersensitivity reaction, inhibiting acetylcholine release at the neuromuscular junction, shown as the inhibiting chains on acetylcholine at the neuromuscular junction. Usually, Lambert-Eaton syndrome arises as a paraneoplastic syndrome, the parachuting neoplasms, and the antibodies to the presynaptic calcium channels may be formed through a malignancy, like small cell lung cancer, depicted as the small lung tumor guise. Symptoms of Lambert-Eaton syndrome include proximal muscle weakness, shown as the P proximal muscles, and this weakness is usually overcome throughout the day and improves with muscle use. This is illustrated as the muscles improving with use. Furthermore, patients can have autonomic symptoms like dry mouth and impotence, along with blurred vision and constipation, and this is represented by the atomic auto. Patients with Lambert-Eaton also show extraocular muscle sparing, seen as the eye muscles signaling they're okay. Thus, the classic Lambert-Eaton syndrome patient has proximal muscle weakness in the morning that slowly improves with repeated muscle use. They have autonomic dysfunction, and oculobulbar involvement is rare. This presentation is really important to help distinguish this syndrome from myasthenia gravis, where the weakness occurs throughout the course of the day, the weakness is usually not as apparent in the mornings, and eye involvement is very common. In Lambert-Eaton syndrome, diagnosis can be made using EMG or electromyography, where repeated stimulation of a muscle shows gradual improvement in strength. Additionally, Lambert-Eaton syndrome has a negative tensilon test, or edrophonium test, while myasthenia gravis responds to this test by improving muscle strength. So to review Lambert-Eaton syndrome, it occurs due to antibodies to the presynaptic calcium channel on motor neurons, which inhibit acetylcholine release at the neuromuscular junction. This syndrome often arises as a paraneoplastic syndrome as a result of malignancies like small cell lung cancer. Symptoms include proximal muscle weakness in the mornings that improves with muscle use as the day goes on. Patients also have autonomic symptoms and typically display extraocular muscle sparing.
Everything we learned today and more is available in